name is Reese. I'm a master barber at Frame Barbershop here in Millersville, Georgia. I'm also an 8-year prostate cancer survivor. I'm also part of iCCaRE for Black Men Research Program, where we educate Black men about the importance of paying attention to their health. We continue our series of Barbershop Conversation Days with Dr. Ernie Kaninja. He's Associate Professor of Public Health at Georgia College here in Millersville, Georgia. He is also one of the principal investigators for iCCaRE for Black Men Research Program. Our topic today is the importance of checkup or screening for prostate cancer. So Dr. K, let me ask you, why should Black men get screened for prostate cancer?
Well, that's a great question. Well, besides skin cancer, prostate cancer is the most commonly diagnosed cancer among men in the United States of America. So Black men and men who have a family history of prostate cancer are at a higher risk for this disease. Now, if you go back to 2022, you realize that over 41,000 Black men heard the dreaded news: you have prostate cancer. So in other words, in 2022, over 41,000 Black men were diagnosed with this disease. Now, each individual has a different risk factor, which is determined by your age, your race or ethnicity, or also your genes, all right? But nearly all men who are diagnosed with prostate cancer can expect to live for 5 years or longer. Actually, 90% of men who are diagnosed with prostate cancer live for 15 years or longer. But the key here is early detection. Early detection and treatment helps to improve the prognosis of any person, any patient diagnosed with prostate cancer.
Okay. So why when Black men go for annual visit for doctors, what are some of the things they should talk to the doctor about?
That's an excellent question. So the first thing before you even go to your doctor is to figure out if you have a family history of this disease. So did your father, did your brother, did an uncle ever have this disease? So when you do go to your doctor, you want to let the doctor know about your family history, if there is any, with this disease. Also, if you are experiencing any symptoms. So for example, if you are having difficulties with urination, when you go to pee, you're having troubles to pee, you definitely want to let the doctor know that. If you're making frequent trips to the bathroom, when you go to the bathroom, you cannot completely empty your bladder, all right, you keep going, you want to let your doctor know that. If you're having blood in your urine or blood in your semen, you definitely want to let the doctor know that. And then also, if you're having any difficulties with erection, all right, if you're having any difficulties with your erection, you definitely want to let the doctor know. The third thing, so besides your family history and besides any symptoms that you may be experiencing, the third thing that men should be having conversations with their doctor about is if you are interested in getting checkup or getting screened for prostate cancer. Now, we know that the women do this all the time, right? They go get their mammography done annually or every 2 years, whatever the guidelines may be. So if you are interested in having that peace of mind of knowing your status, whether you have the disease or not, so mention that to your doctor if you have an interest in getting screens.
So Ernie, why should men that haven't been diagnosed be thinking about screening for prostate cancer?
Well, so that's a great question, because as a matter of fact, there are some benefits in terms of screening. So one of the benefits is early detection, as we just said. If you find the disease early enough before it spreads, it leads to better treatment options, which means the doctors have more tool in the toolbox in terms of the treatment options, all right? It also helps in terms of long-term survival. If found early, the long-term survival are better. Another key benefits of getting screened is just having a history of the disease, all right? So if you know your history, all right, 1 year, the next year you screen again, you could tell if you're having the disease, is it getting more aggressive, all right? So that history helps also the doctors to better determine if you have an aggressive form of the disease, all right? Another key reason, again, is because having that information helps the doctors to design a plan, a treatment plan that would really work for you based on the disease that you may have.
So Dr. K, if a man thinks he might have prostate cancer,
I mean, what questions should be asking the doctor?
Well, so one of the things you may want to talk to your doctor about is, why do you feel that you might have the disease? So you want to explain to your doctor that concern. Also give the doctor some reasons why you are concerned. Why is it? All right. Secondly, as we mentioned before, you want to include any relevant family history. All right. Include any person in your family who may have been diagnosed. Thirdly, you also want to mention any symptoms, and not just mention symptoms that you may be having. Provide more details. How long have you been having these symptoms? Do the symptoms persist? Do they stick for a longer time? All right. So you definitely want to let the doctor know how long, to what extent you've been having symptoms, and then discuss any concerns that you may have about getting screened or getting tested.
Okay. So Ernie, this is a different path you're going now. What can I expect from prostate cancer screening? Because I'm a little nervous. I mean, what can we expect? What can we expect when we go to prostate cancer screening?
Yeah, so basically your doctor will explain to you the different options in terms of screening. So I'll give you an example. One method that some doctors will use to get you screened for prostate cancer, we do a blood test. Okay. So similar when you go for your annual physical exam, they do a blood draw, they check for your cholesterol. Well, the doctor can also request that they do a check for the prostate-specific antigen test. That is a test that will let them know about your prostate health. So that's just one screening method. Okay. There is another screening method, which is the digital rectal exam. So basically, the doctor will use the finger through the anus to get a feeling for your prostate. And what the doctor is doing there is to see if there's any abnormalities that he or she should be concerned about. And then you also have a third approach, which is the transrectal ultrasound. It is more like an MRI, that they do an imaging of the prostate area to determine if there are any concerns.
Okay. So I've got screened now. So what can I expect my results? Who's going to explain this to me? How are we going to explain what the results are? I know we have done the screening now. So what can I expect the result come in? Because whenever you're talking about cancer, I'm getting a little nervous. So what can I expect? What can I expect the result to come in? What do the results mean?
No, that's an excellent question. So it depends. We just talked a minute ago about the different types of tests. So it depends upon the type of screening test that was done. It also depends on where the analysis was done. Say they did a blood draw. Did they do the analysis in your city? Did they have to send your analysis to a university hospital someplace? So where the type of test and also where the analysis is done could determine. But in general, we're talking about days, maybe a week or so. So days, maybe a week. Now the doctor, once the results come back, will give you a call, or a nurse from the doctor's office will call to tell you what the results mean. But let me just say this. You can have prostate cancer without having any symptoms. All right? You can have prostate cancer without showing any signs or any symptoms. Now, while it is uncommon for younger people to have prostate cancer, any male can actually have prostate cancer. All right? So early detection and treatment leads again to better treatment options. All right? It also leads to less treatment side effects. Now we talk about the younger people. Let's just talk about the older people too. Now, most prostate cancer is found in men 65 years or older. All right? Now, older age means that you may possibly encounter greater treatment side effects. All right? So basically what that means is the older you are, the higher your chances of getting prostate cancer. All right? So it's important to know that men, young or old, can be diagnosed with this prostate cancer.
Why should we pay attention to prostate cancer?
Well, you want to avoid surprises. As we said, again, it could occur if you're young, it could occur to you. More likely if you're older. You want to avoid surprises. All men, as you age, are susceptible to prostate cancer. So all men, the older you get, all right, the higher your chances of getting a prostate cancer diagnosis. Now, the earlier it is detected, all right, the easier it is to treat. So early stages of prostate cancer often have no symptoms. They have no signs, all right? Symptoms often appear when the disease has spread to other organs or when the stage is higher stage. So basically, it's important for men to pay attention to prostate cancer because again, it could come at any age, at any stage. You definitely want to pay attention to your body. You want to have a system where you're routinely seeing your doctor and getting screened or getting checked up for this disease.
Can you tell us some of the popular signs and symptoms that men should look for?
Yes, so you can definitely get prostate cancer without showing any signs or any symptoms, all right? But especially if you're older, let me just tell you some of the things to watch out for. So one of them is if you're having difficulties when you go to the bathroom to urinate. If you have difficulties to pass urine, or you have a decreased force in terms of the stream of your urine. Also, if there is blood in your urine, you definitely want to pay attention to that. Also, if you have frequent trips to the bathroom, so you go frequently to the bathroom, you do not fully empty your bladder, all right? If there is blood in your semen, that's definitely a sign to be having a conversation with your doctor. If you're having blood in your semen, you want to have conversation with your doctors. If you have bone pain, all right? Also, if you lose weight without making any effort to lose weight. And then also, as we mentioned before, if you're having erectile dysfunction or you're having difficulties with having an erection, you definitely want to make sure you let your doctor know that. Now, let me just say this. So not all of these would immediately mean that you have prostate cancer. But if you have any or some of these symptoms and they persist over a long period of time, you should definitely bring that to the attention of your healthcare provider, especially if you are not getting routine checkup. So again, none of these signs is definitive that you have prostate cancer, but if they persist, you definitely want to have a conversation with your healthcare provider. So treatment for prostate cancer includes the treatment for these symptoms to make sure that you have a better quality of life.
You know, as we come to the end of this conversation, Ernie, I think about when I went through prostate cancer. What are some of the questions that men watching the video should be asking? I didn't know what to ask anyone. Didn't know no question to ask. So, can you help us out and tell me what question we should be asking doctor when we go to the doctor? We go through the screening process and everything. Can you kind of explain a little more what can be asking the doctor about prostate cancer?
No, that's an excellent question. So for every or any man watching this video, you could have a conversation with your physician, with your healthcare provider. And one of the questions you can ask them is, when should you get screened for prostate cancer? All right. Secondly, you can ask them what prostate cancer screening options are available to you. So given your personal history, also given your family medical history, what screening options are available for you, all right? You could also ask the question, how often should you be screened for prostate cancer, all right? Also inquire from them, as you asked before, what does the test result mean? If you get the test result, what does that mean, all right? What symptoms or what changes should you be looking out for? And then also ask your healthcare provider, how should you let them know if you are experiencing any of these symptoms?
Okay, thank you so much for your time, and hopefully some things you said that men will reach out to. Some of the things you talk about, I've been through, I didn't know the question. So, I mean, you're very informative what you're giving today, because I didn't know what to ask. I didn't know anything about prostate cancer. I just want to thank you so much on behalf of all men to give the information we got today. Thank you so much.
Thank you so much, Don. Glad to do it.
Trust me, you will be okay. You'll fight through it. I am fine. I'm 45 now. I feel great. I can go to the gym and work out with the big dogs. Trust me, I can. And that's after me having prostate and really lost everything. I have no strength or none of that. I work myself back up where I'm at. I feel great. It can happen, guys. Trust me on this.